Struggling with GI questions on the NCLEX? You're not alone. But guess what? The secret to passing might just be in the last 2 questions of this video. These aren't just practice questions, they're real clinical thinking drills with strategies that help you pass. Stick around, because every question builds your confidence. And the last ones? They're the NCLEX game changers. Hit like, grab your notes, and let's turn confusion into confidence, starting now.
Question 201. A client with advanced cirrhosis is being monitored for hepatic encephalopathy. Which medication does the nurse anticipate administering? A. Lactulose, B. Ranitidine, C. Omeprazole, D. Ondansetron. Correct answer, A. Lactulose. Rationale: lactulose reduces serum ammonia levels by increasing the frequency of bowel movements and trapping ammonia in the colon. It is the first-line treatment for hepatic encephalopathy, a common complication of advanced liver disease. Strategy: link medication action to pathology. Hepatic encephalopathy equals elevated ammonia. Use lactulose. Eliminate options unrelated to ammonia clearance or liver detoxification. Question 202. The nurse assesses a client post-colonoscopy and notes abdominal guarding, increasing pain, and left shoulder discomfort. What is the nurse's priority action? A. Administer pain medication. B. Notify the healthcare provider. C. Reassure the client. D. Encourage ambulation. Correct answer, B. Notify the healthcare provider. Rationale: abdominal guarding, referred shoulder pain, and worsening discomfort post-colonoscopy may indicate bowel perforation, a medical emergency. Prompt provider notification is essential. Strategy: recognize red flags. Guarding and referred pain post-GI procedure equals perforation until proven otherwise. Eliminate comfort measures until life-threatening issues are addressed. Question 203. A client receiving continuous jejunostomy tube feedings begins coughing and gagging. What is the nurse's immediate priority? A. Flush the feeding tube. B. Lower the rate of the feeding. C. Stop the feeding and assess respiratory status. D. Administer an antiemetic. Correct answer, C. Stop the feeding and assess respiratory status. Rationale: coughing and gagging may signal aspiration risk, particularly in clients receiving enteral nutrition. Feeding must be halted immediately, and airway assessment is the priority. Strategy: use airway first thinking, ABCs. Stop feed, check for aspiration, then intervene. Eliminate options that delay assessment or increase risk. Question 204. Which client is most at risk for complications from long-term proton pump inhibitor PPI therapy? A. A 25-year-old with acid reflux. B. A 34-year-old with a history of ulcers. C. A 78-year-old with osteoporosis. D. A 40-year-old who smokes. Correct answer, C. A 78-year-old with osteoporosis. Rationale: PPIs decrease calcium absorption, increasing fracture risk in older adults. Long-term use is linked to osteoporosis and C. difficile infections. Strategy: consider age plus comorbidities plus drug side effects. Match the client profile with known risks of the medication. Question 205. The nurse is caring for a client with severe acute pancreatitis. Which lab value requires immediate intervention? A. Serum calcium, 6.8 milligrams per deciliter. B. Amylase, 220 U per liter. C. Glucose, 160 milligrams per deciliter. D. WBC, 12,000 per cubic millimeter. Correct answer, A. Serum calcium, 6.8 milligrams per deciliter. Rationale: hypocalcemia is a serious complication of pancreatitis and may indicate fat necrosis. Calcium below 8.5 milligrams per deciliter can cause tetany and cardiac disturbances. Strategy: no lab priorities. Pancreatitis plus low calcium equals red alert. Don't be distracted by mildly elevated labs like glucose or WBC unless life-threatening. Question 206. A client with ulcerative colitis is admitted with dehydration and electrolyte imbalance. Which physician order should the nurse implement first? A. Start 0.9 normal saline IV. B. Obtain a stool sample. C. Apply a heating pad to the abdomen. D. Administer acetaminophen for pain. Correct answer, A. Start 0.9 normal saline IV. Rationale: fluid resuscitation is the first priority in dehydrated clients to restore perfusion and prevent hypovolemic shock. Other orders can wait until stabilization. Strategy: apply Maslow's and ABCs. Fluids take precedence in dehydration. Eliminate non-life-saving or comfort measures.
Question 207. A client is being treated with total parenteral nutrition, TPN. Which assessment requires the nurse's immediate action? A. Capillary blood glucose, 210 milligrams per deciliter. B. Temperature, 101.5 degrees Fahrenheit, 38.6 degrees Celsius. C. Hematocrit, 38%. D. Blood pressure, 130 over 80 millimeters of mercury. Correct answer, B. Temperature, 101.5 degrees Fahrenheit, 38.6 degrees Celsius. Rationale: TPN is delivered via central line, increasing sepsis risk. A fever may be the first sign of central line-associated bloodstream infection, CLABSI. Strategy: monitor central lines for infection. A high temp in a TPN patient is a red flag. Glucose may be expected to rise slightly, but fever demands rapid response. Question 208. Which discharge instruction is most important for a client post-laparoscopic cholecystectomy? A. Resume a high-fat diet to promote bile flow. B. Remove the surgical tape 24 hours after discharge. C. Report shoulder pain immediately. D. Notify the provider if signs of infection develop. Correct answer, D. Notify the provider if signs of infection develop. Rationale: though laparoscopic procedures are minimally invasive, any signs of infection, fever, redness, drainage, require prompt attention. Most shoulder pain is expected due to CO2 gas, but still monitor. Strategy: choose patient safety education that focuses on red flags post-op. Eliminate expected findings like shoulder pain unless they worsen or persist. Question 209. A client with Crohn's disease is at risk for malabsorption. Which nutritional deficiency should the nurse monitor for? A. Vitamin B12. B. Vitamin K. C. Calcium. D. All of the above. Correct answer, D. All of the above. Rationale: Crohn's affects the small intestine, leading to malabsorption of multiple nutrients, including B12, fat-soluble vitamins A, D, E, K, and minerals like calcium and magnesium. Strategy. When asked about risk, choose the most comprehensive or inclusive answer unless otherwise directed. Crohn's equals broad malabsorption. Question 210. Which finding is most concerning in a client with suspected GI bleeding? A. Hemoglobin on 12,2 gramma per decilitra. B. Melena. C. Hematocrit 37%. D. Bradycardia. Correct answer, B. Melena. Rationale. Melena, black tarry stool, indicates upper GI bleeding and requires urgent intervention. It reflects active or recent bleeding. Strategy. Identify visual or physical signs of bleeding as red flags. Labs may lag or seem normal early on. Visual confirmation equals emergency.
If you enjoy this, hit subscribe and like. It helps us make more videos like this for you. We love you.